artificially. So wala siya na fit bala sa description sa vitamins ang B4, B8, 10 kag 11. Amo na nga wala sang amo na nga vitamins. Okay, so ADEC fat soluble, the rest are water soluble. Okay, so next question. Normal needs for water are met by consumption of, so that is 2 to 3 liters a day. So typically we get about 20% of water from the food we eat, and then taking into account, so mas gakinanlan sa damo nga water ang male compare sa female sa average na yaha. So women need about 9 cups, while men 12.5 cups to help replenish the amount of water that is lost. So some health experts recommend 8 ounces of glasses a day. So walo ka 8 ounce kuno nga tubig kinahanglan. So this is equivalent to 2 liters or half gallon a day. So 2 to 3 liters is recommended also. So this is called the 8 by 8 rule. So meaning walo ka 8 ounce na tubig. So however, some experts believe that you need to sip on water constantly throughout the day even when you're not thirsty. Kay there are some experts nga nagambal nga once na-feel mo na nga nauhaw ka, meaning start ka na mag-dehydrate. So hindi mo kinahanglan hulaton nga mauhaw ka before ka mag-inom tubig. So continue to drink water any time of the day bisan wala ka nauhaw. So kay may mga water loss ka because of sweat and other excretion, so ihi, pamuson, so mainom gyapon tubig. So amo na kay kung once mag-feel ka na nga nauhaw ka or thirsty, meaning dehydrated ka na. So 1 gallon is about 3.8 liters, and 1 liter is about 0.27 gallons. So normal water is 2 to 3 liters. Next, it represents the highest level of disease prevention except. So ang choices today is medicine, education, promotion, and belief. So medicine, so yes, very effective siya for disease prevention. Education also for prevention man. Promotion of health. So that is also an effective way to prevent diseases. And the last one is belief. So hindi na siya syempre except eh. So belief is not effective it's not an effective way to prevent certain diseases or the promotion of good health. So belief ang answer. Next, thiamine is also known as, so na-discuss ko naman siya ang lain nilang ngalan, so that is B1 is thiamine. Next, we have TB vaccine. So, ang ginagamit nga vaccine for tuberculosis is Bacillus calmette-guerin or guerin, which is the BCG. So, ang MMR, ginagamit na siya for measles, mumps, and rubella. So, anong kinalain sa measles kag sa rubella? So, ang measles, rubiola na siya. Ang German measles is rubella. So, measles or red measles, that is rubiola. So, ang MMR vaccine, so amo na siyang ginagamit for measles, mumps, kag rubella. So, ang varicella, for chickenpox. So, that is for vaccines ang chickenpox, ang varicella vaccines. So, measles is an acute viral respiratory illness. So, usually taas ang hilanat, may body malay or gapalamuipoy ang lawas, nakapoy. And then the 3 C's, tatlo ka C, the cough, coryza, and conjunctivitis. So, ang coryza, so it is also na coryza, dali lang get ang ako niya sulat. So, usually kuno ang measles, characterized na siya sang taas nga hilanat, body malay, tatlo ka C. So, 3 C's, which include the cough, coryza, and conjunctivitis. So, coryza is also commonly known as your rhinitis or irritation and inflammation sa mucous membrane sa nose. Kritik kabalo naman kamo sa conjunctivitis, so inflammation sa conjunctiva, which is part of the eyes. So ang measles, acute viral respiratory illness, while ang German measles or ang rubella is a contagious disease caused by virus man. So although ang rubella kag rubiola or ang measles kag German measles, so pareho sila nga viral infection, pero they are caused by different viruses. So ang rubella, amo ni siya ang German measles, so it is caused by RNA virus known as rubivirus. So amo niya family sang virus eh. So it can spread by contact with infected secretions. While ang rubiola or your common measles or ang red measles is caused by RNA virus man pero morbillivirus iya ngalan. Area rubivirus, area morbillivirus. Walain man siya nga family halin. So it can spread by contact with infected secretions as well as airborne droplets. And for the another vaccine is the DTaP. So DTaP for or sa iban gani tawag nila is DTP or iban is DPT for diphtheria, tetanus, and pertussis. So diphtheria, pertussis, kag tetanus. So muna siyang vaccine. So diphtheria and pertussis spread from person to person while ang tetanus nagasulod na siya kung may pilas ka. So especially kung mamnabal yung mga lansang, mga stick, barbecue stick. So kung may ara na da nga bacteria, Bacterium tetani, so pwede siya masulod sa pilas, so pwede ka matetanos. Diphtheria is a serious infection caused by strains of bacteria called the Corynebacterium diphtheriae. So, maning causative agent sang diphtheria. So, it produces toxin or poison. It can lead to difficulty of breathing. Then also heart failure, paralysis, or even death. For the pertussis, it is commonly known as the whooping cough. Inang daw ginabarukoy, nga rin ka nakaginhawa, sakit na sa ulo. Uncontrollable, violent coughing, which often makes it hard to breathe. It is very contagious. Ang iyang causative agent is Bordetella pertussis. So, it attaches to the cilia. Cilia is a tiny hair-like extensions that line the part of the upper respiratory system. So, katol-katol siya, sakit na sa ulo, kay barukoy ka na sa ububudlayan ka na maginhawa. Tetanus is an infection caused by Clostridium tetani. So, this is the causative agent. When the bacteria invade the body, they produce a poison, pareho man to sang Corynebacterium diphtheriae. So, it can cause painful muscle contractions. So sometimes ginatawag na nila nga lakjo ang tetanus kay tungod kung severely affected ka na, nagalak na ang neck kag ang jaw muscles, then hindi mo na siya ma-open or budayan ka na magtulon. So, DTP or DTAP or DPT ginagamit for diphtheria, tetanus, and pertussis. MMR ginagamit for measles, mumps, kag rubiola. Then, ang ato kagina ang aton nga sa TB, so ang ginagamit is Bacillus calmette-guerin or BCG. So, used primarily for TB and it is named after the inventors na si Albert Calmette kag si Camille Guerin. Okay, so next question. Therapy given prior or before to exposure of a certain disease. So, syempre hindi treatment. So, it is chemoprophylaxis. So, chemoprophylaxis, lang. Tabunan siya, dali lang. So, chemo prevention, also known as chemoprophylaxis, refers to the administration or ginapainom siya before ka ma-expose sa isa ka disease. Like for example, most common na siya, halin pa sa una, magpapalawan, nag-take sang chemoprophylactic drugs para nga ma-avoid ang malaria. Hindi ka tumalatnan sang, hindi ka maka-acquire malaria sa Palawan. So, antibiotics, for example, may be administered to patients with disorders of immune system function to prevent bacterial infections, like ang mga opportunistic infection. So, magsiling kita ng opportunistic infection. So, actually, ara na nang daan ng bacteria. So, nagapahunay-hunay lang siya, nagaulat lang siya sa opportunity para makakos ang disease. So, opportunistic na sila, opportunistic pathogens. So example niya na, for example, may ara kita da nga opportunistic pathogens sa buli, sa anus, ara siya kay star. So wala ka man masakit pero ara man siya nga daan. Pero once magsaylo na siya, like for example sa urethra sa babayi or sa vagina, so pwede siya makakos infection. So amo na siya nga tawag nga opportunistic infection. So, kung wala siya sa iyang lugar nga dapat nga butangan ng silo sa iban, so makakos siya masakit. Chemoprophylaxis for other tropical infections. So, amo ng mga tropical infections sa mga tropical areas, like example, kung Palawan, is not as well established but should be considered for the traveler who plans to expose themselves to a higher level of risk. So actually do wala man gid siya yung gina-recommend gid wala nga mag-inom sa prophylactic drugs para ma-avoid mga disease. Pero gina-consider siya especially sa mga ga-travel sa ibang lugar nga may mga widespread nga mga diseases like amo na malaria for example. So before magkadto nagainom sang prophylactic drugs. Post-exposure or after exposure prophylaxis is provided after unforeseen exposure to infectious agents that can have serious consequences. So, bali ang chemoprophylaxis, so other name niya na is chemo prevention, ang isaya ka klase nga prophylaxis is post-exposure prophylaxis. So, ang chemoprophylaxis before. Siyempre, ang post is after. So, for example, naglakad kasi sa kalugar or tapos nagpuli ka na. So, may possibility you are suspecting naka-infect ka or nakakuha ka ro sang isa ka-infection or naka-acquire ka infectious disease. So, ginapainom sang post-exposure prophylactic drugs. So, example, we have here para sa malaria. So, duha ka klase ang ginagamit nila nga drugs sa blood stage for blood stage prophylaxis or suppressive prophylaxis and liver stage or causal prophylaxis. So, sa blood stage, so examples ng drugs, so these are generic names, mefloquine, doxycycline, chloroquine. So, this prevents primary infection and completely prevents only P. falciparum and P. malariae infection. So, mga causative agent ni siya nga nagakosang malarial infection. And it should be continued for 4 weeks after the traveler has left the area of a place nga may endemic disease. While ang liver stage prophylaxis naman like Primaquine prevents primary infection, pareho man sila, primary infection, as well as late onset illness. So kung halimbawa, kung dito ka sa lugar, wala kaya kabatsyag, wala ka signs and symptoms, later na ya, pagpuli mo na. So effective ni siya ang liver stage prophylaxis. Completely prevents all types of malaria. So area ang blood stage, ang ma-prevent niya lang is P. falciparum kag P. malariae. The rest hindi niya ma-prevent. Pero with the Primaquine, so late onset, pwede pa gid siya and all types of malaria. It can be discontinued after the traveler has left the area of endemic disease. Area, sige pagyap mo nang inom, 1 month pagid after makapuli ka or 4 weeks. Diriya, kung makahalin ka na sa lugar, so pwede ka nakastop inom. Okay, so next, the type of isolation practiced to prevent the spread of infectious agents in aerosol form. So, ang keyword nyo na da is aerosol. So, meaning that is respiratory isolation. So, isolation in the hospital setting, discuss ko naman siya kagina, pero the overview lang to. So, in the hospital setting, isolation refers to additional precautions taken to prevent transmission of infectious agents such as bacteria or viruses between people. So, ang isolation technique, so gina-practice pa gina siya in addition to other precautions nga gina-recommend sa hospital settings. When a patient is placed in hospital isolation, precautions are followed by healthcare staff and visitors to help protect the patient. So either isolation siya or reverse isolation as long as it is performed, practiced to safeguard the health of the patient. Individuals that have contact with them and other patients from contagious diseases. The term isolation is frequently confused with quarantine or solitary confinement. So when we say isolation, so patients under isolation are rarely black. So wala na sila yung ginapunggan yung makipag-interact sa iban as long as may ara silang mga protective equipments and they practice additional precautions recommended for their case. So instead, isolation means that individuals who enter the patient's room and interact with them need to use additional precautions. Okay? So wala na sila yung block from interaction. Unlike mo siling kita yung quarantine or solitary confinement, so ikaw lang gid isa, hindi ka pwede makapag-communicate sa iban. So actually tani ang tsakto tani nga term subong na bala sa mga quarantine during this COVID time. Tani hindi na kuno quarantine kay kamo siling ka quarantine daw solitary confinement, ikaw lang yung isa. Dira ka lang, di ka kagwa, di ka makaistorya sa iban. Tani isolation lang. So these precautions can include hand washing more frequently and wearing of PPEs such as gowns, masks, or gloves. So there are types of isolations. So arin siya sa choices naton. So strict isolation, this is imposed. So Gina-practice na siya to prevent the spread of disease. So usually, kuno it lasts for about 40 days of detention or isolation imposed upon sa mga persons nga halin sa barko, the animals or plants on arrival at a port or place. So when suspected of carrying some infectious or contagious diseases, so amo na gina-isolate anay, hindi na tani, amo na ganambal ko ni tani, quarantine ang term. Isolation lang tani. Next is contact isolation. This is used when a patient has an infectious disease that may be spread by touching, contact mo. Touching either patient or other objects the patient has handled. Contact precautions usually require medical staff and visitors to wear protective apparel such as gowns, gloves, masks when entering the patient's room. Kaya diba si makontaminate ka sa patient or sa mga inanimate objects nga matandog mo dira sa iyang room like mga doorknobs, cell phones, bed, chairs. Then protective isolation for severely immunocompromised patients. So amo ni aton na gin-mention ko kagina ang aton nga reverse isolation. So this is to prevent contamination or infection with microorganisms. For example, protective isolation is used for patients with burns or leukemia or atong mga transplant patients. So na-mention ko man kagina. Then last, we have the respiratory isolation. So used for diseases that are spread through particles that are exhaled, like ang COVID na subong eh. So those having contact with or exposure to such a patient are required to wear a mask. So these are the types of isolation. Then we also have the types of precautions. So the CDC or the Centers for Disease Control and Prevention identifies two main categories of safeguards or precautions. So we have standard and transmission-based precautions. So standard precautions, these are practiced for all types of patients. While transmission-based precautions, these are needed when an infectious disease is suspected or diagnosed. Ariya ga suspect ka man or wala, so gina-perform ni siya, gina-practice. So ariya gina-practice ni siya if suspected or diagnosed ang patient with a particular infectious disease or contagious disease. These special transmission-based precautions generally fall onto one of three forms of isolation. And according to CDC, the three standard categories of transmission-based precautions include contact, droplet, and airborne. So, under ni siya sa transmission-based precautions. So standard precautions, so these precautions again are followed by medical staff when caring for all patients. So bisan wala sila known infectious disease, so like hand washing, so gina-perform, gina-practice. Standard infection control precautions include hand washing, sanitizing before or after leaving the patient's room. So PPE like gloves, masks, safety glasses, gowns, aprons, and shoe covers may be used when exposure to bodily fluids like blood, saliva, urine is possible. So kung feeling mo ma-expose ka sa body fluids ng patient like sa magsikan ka sang lalaway, sang ihi, or sang blood, or may open wound siya, or ikaw may open wound, so you need to wear PPE. Pero subong nga tiyempo nga may COVID, so regardless of standard or transmission-based precautions, gagamit man gyapon PPE sa ating mga healthcare workers. So sa standard precautions na siya ha. For transmission-based precaution, so na-mention ko yung tatlo, nakaklase, contact isolation, droplet, and airborne isolations. So sa contact, this is practice when a patient has an infectious disease that can spread by touching the patient or other objects the patient has touched or handled. Contact precautions usually require the staff as well as the visitors to wear PPEs like gowns and gloves when entering the patient's room. For droplet isolation naman, so gina-practice ni siya if the patient has an infectious disease which involves the respiratory system. So, para nga hindi malatnan, kung mag-sneeze si patient, mag-cough or mag-talk, magsikan sang laway, so ma-practice ang healthcare worker sa droplet isolation technique. Droplet precautions such as wearing of surgical masks, goggles, or face shields, so mga nasubong ginaubrata, help prevent contact with nasal or lung secretion containing the infectious agent. So kay ang COVID virus droplet na siya ang iyang spread. Pero may mga studies na sa mga later part na airborne na siya kuno hindi na sa droplet. Anong kinalain sa droplet sa airborne? So kung droplet malatnang kala na kung lapitanay ka mo like matchi siya, magambal siya magsikang sang laway or magubo. Pero kung airborne, so pwede na siya makalutaw-lutaw anay sa air kag mahaklo mo. So the strictest level of isolation, so ang pinaka-strict nga level sa isolation is airborne isolation. So it is needed when disease causing agents can float ang makugalutaw sa hangin and be breathed in by surrounding people. In some cases, airborne agents such as viruses can travel into hallways or other rooms, infecting other patients, staff, or visitors. So, since airborne siya, pwede nga may infectious na nga patient nga nag-agi sa hallway, nangatsi, tapos after pila ka minutes, nag-agi ka man da, ara pa da ang virus sa hangin, so maklo mo siya. Patients under airborne isolation are typically placed in isolation rooms called negative air pressure rooms, where the air is removed through a specialized filter system and not allowed to flow into other spaces. So kung ang mga patients, they are categorized under airborne isolation, so ginabutang na sila sa specialized nga room called the negative air pressure room. So meaning sa negative air pressure rooms, ang hangin nga halin dira sa room sa patient wala ginaalaw nga magwa sa mga pertahan, sa mga bintana. Instead, may specialized filter nga dira nagagwa ang hangin halin sa room sang patient. So, para hindi na siya maklo sang iba niya A closed door is typically required for airborne isolation. So meaning kung naka-airborne isolation isa ka patient, kinahanglan sirado iya nga pertahan. Kay ti ginagamitan gani isang specialized filter para nga sa masala ang iya nga hangin na sa kwarto kag sa lain siya nga area ginapagwa. In addition to personal protective equipment used under standard precautions like gloves, safety glasses, gowns, aprons, and shoe covers, medical staff generally wear specialized respirator, iba naka-hazmat, when they enter airborne isolation rooms. So usually kung ang patient na sa airborne isolation room, ginalimit ang number of visitors nga makabisita sa iya. Siyempre kay mag-abris ang pertahan, magwa ang hangin, so pwede ma-contaminate ang ibang area sang hospital outside the patient's room. So that is for airborne isolations. So far guys, may questions ka mo or clear lang, naintindihan lang? Nakapanyaga man wala ka mo energy gid mag-ano, so ara gali si Juthea. Sige. Okay, so let's proceed. Next, an iatrogenic infection is one caused by, so magsiling kita nga iatrogenic. So this is an infection that occurs after a medical or surgical management procedure has been done. So, na hospital man nun wala ang patient, pero kung ang cause niya nga infection is due to medical or surgical management, kung OPD man na siya, so pwede na siya makonsider nga iatrogenic infection. So, a state of ill health or adverse effect caused by medical treatment usually results from a mistake made in diagnosis or treatment and can also be the fault of any member of the healthcare team. So, for example, sa atong department, nalipat ka sa laing mo marker, ang left, ginbutang mo sa right. So, na-misdiagnose ang patient. For example, na-diagnose siya nga ang ang iyang heart ara gali sa right, kay ti ang imong marker suli. So, in-advisean siya for medical intervention. So, ang pasyente, imbis nga wala balatian, nagkabalatian, kay ti ginabulong siya sa wala sa masakit. So, that is an iatrogenic fault. Or pwede man, for example, because of sala nga diagnosis, because ang obra sang isa ka healthcare worker, so pwede man nga nagka-infection ng patient, kaya painom siya sa bulong, so wala siya masakit. So, iatrogenic infection man na. So, iatrogenic events may lead to physical, mental, or emotional problems, or in some cases, at worst, so pwede mapatay ang pasyente. So, example, if you were to become infected because a healthcare provider didn't wash his or her hands after touching a previous patient, so pwede ka malatnan. For example, nag-attend siya sa ka-patient, ang patient tugali may contagious disease, why siya nang hinaw, or wala siya ng alcohol, wala siya ng ilis ng iyang gowns, dito po na siya halin sa iyang pasyente nga infectious, nagkadto siya sa imo, nalatnan ka, so that is an iatrogenic infection. So, pwede na siya makasuhan ang personnel or ang healthcare worker or ang hospital mismo. Kay because of the receipt sa locator, so obvious man nga dira mo nakuha, and because also of the respondeat superior, so pwede ang hospital maging liable man. Next is limitation of freedom of movement of highly contagious person or domestic animal. So, ari highly contagious, so amo na gina-quarantine. Wala na na gina-isolate kay highly contagious, meaning, ginalimit gid ang iyang freedom, di siya kagwa do solitary confinement. So, that is quarantine. Next, preventive measure against communicable diseases. So, diin di kuno ang ways na pwede maka-prevent sang spread sang communicable diseases. So, first, sanitary superstition, then education, personal hygiene. So, the correct answer is tanan na sila. So, bisan superstition na siya, pero makabulig na siya para ma-prevent, for example, ang iba nagapati nga kung magwa ka sa balay mo ma-infect ka, so pwede siya gyapon sa nituod, so pwede siya gyapon maka-help to prevent the spread of a communicable disease. So all are correct. Next, the two oval openings in the nose are called the oval openings are called the nares. So the nasal concha or concave, so concave kung plural. So ang other term niya na is nasal turbinate. So nasal ara da sa isa man sa mga choices. Nasal turbinate, which is a long, narrow, curled shelf of bone. Do scroll na siya gani. Do scroll like that protrudes into the breathing passage of the nose, and it is also a thin scroll-shaped bony elements forming the upper chambers of the nasal cavity. So as you can see, tatlo ka layers ang aton nga concave, superior, dire, of course, the middle, and the inferior. So ang purpose na sa aton nga nasal concave is to increase the surface areas of the nasal cavities. So kumbaga para may room pa for expansion. And also, ang nasal concave provides for rapid warming and humidification of air as it passes to the lungs. So ang gina-inhale ta nga hangin, so before na siya dalon sa lungs ta, so gina-humidify na siya na or gina-painit. So gina-warm siya and gina-humidify siya before siya dalon sa lungs. So mo na purpose ang nasal concave. Then for the larynx, so ara ang glutis, ari siya. So it is an opening actually. So glutis is the opening between the vocal folds in the larynx. It is a slit-like opening on the floor of the pharynx and a valve that ang purpose niya is control the airflow in and out of the respiratory passages. So amo na siya ang glottis, ang opening na siya. So kung abre amo na siya konsera. So nagakontrol sa amount of air nga nagagwa kag sulod sa aton nga respiratory system. So next, we have the guanea or the internal nares. Meron kita nga external nares kag internal nares. So kung singular, naris siya, naris. Kung plural, e siya. So ang nares is the opening sa nose. So we have the internal ang balko kag external. So ang internal amo na siyang guanea. Are. Sorry di siya ho. And then ang external amo na ang buho sang aton nga ilong. So ano siya? So ang buho amo na siya ang nares. Ang dire, this is called ang division is called a septum or nasal septum. Okay, so next. So mo nakaginahan ko ang other terms ang concave is the turbinates. So, pareho na sila, concave kag turbinates. Ang glutis sa mutong opening. Ang nagakontrol, naga-close, nag-open, kaya nagakontrol sang airflow. Ang sa guaya, two oval openings, the external nares. So next, single cartilages of the larynx include the following except. So except the arytenoid. Kay ang thyroid, ang cricoid, kag epiglottis, single na sila, ay meaning wala sila pares. Ang arytenoid, ya paired na siya. So, let me uh, go to the presentation. So, the laryngeal skeleton is composed of 9 cartilages. We have the thyroid, the cricoid, the epiglottis, arytenoid, corniculate, and cuneiform cartilages. So, the first three, so wala na sila pares, are. So, amo na yung single. And then, the latter three, so paired na siya left and right, left and right arytenoid, left and right corniculate, and left and right cuneiform cartilages. So, we have here the epiglottis, then we have the cricoid, so ari siya, and then the thyroid cartilage, so this one. So, may mga pares na sila. And then, ang mga wala na pares, so area, ang may mga pares, so cuneiform, so left and right, so ara sa piyak ag piyak. Then arytenoid, so left and right man, and cuneiform, also left and right. So ang purpose ng arytenoid cartilages, so this is where the vocal ligaments and vocal folds attach. Okay, so next question. So, important functions of the lymph nodes. So, they produce lymphocytes and antibodies. That is correct. Also, ang lymph nodes nag-serve as filters kag defense against the spread of infection, which is also correct. So, the answer is both are correct. So lymph nodes, these are small, round, or bean-shaped clusters of cells. So inside the lymph nodes are combination of different types of immune system cells. These specialized cells filter the lymphatic fluid as it travels through the body and protects the humans by destroying the invaders. So, para sa immune system na siya primarily. Lymph nodes are located throughout the body. So, spread na siya sa lawas which include the neck, ara sa neck, sa armpits, sa groins, around the gut, and also between the legs. So, in general, amo ni siya ang placement sa aton nga lymph nodes sa lawas. We have the cervical lymph nodes here. Then supraclavicular lymph nodes, may epitrochlear lymph nodes, axillary, and inguinal lymph nodes. So normally, if you have noticed, kung may pilas ka, for example, sa unto, gasakit imo unto, or napilas imo gums, or may singaw ka, usually diri nga area, gabukol, or kisa gani sa likod sa dulunggan, gabukol na tawag ta nga colatid or colani. So, lymph nodes na siya, nagahabok na siya because naga-produce siya ang antibodies para nga ma-fight ang infection. So, kung napilas ka sa tiil, usually, tubuan ka pangadlay sa hita. So, that is your lymph nodes. So, next question, we have the pulmonary veins empty into the left atrium. So, ari ang aton nga pulmonary vein. So, diri siya nag-empty sa left atrium. So ang aton nga superior vena cava, so diri siya nagasulod sa right atrium. So the oxygenated blood is brought back to the heart by the pulmonary veins which enter the left atrium. So halin sa left atrium, the blood flows into the left ventricle. So ang unoxygenated blood, so maasulod diri sa vena cava, then to the right atrium, maagi sa tricuspid valve, and then makadto sa pulmonary valve maagi, then makadto siya sa may ang unoxygenated blood makadto sa may pulmonary artery pakadto na sa lungs kay makuha to siya oxygen. Then matiyong na to sa diri na siya magwa sa pulmonary vein ang blood, so oxygenated na siya. So sa pulmonary vein makadto sa left atrium ang oxygenated blood, then maagi sa mitral valve, then sa left ventricles, and then ma-pass through sa aortic valve, and then pakadto na sa aorta ang oxygenated blood, and then after sa aorta, i-distribute na siya sa different parts of the body. Ma-branch out na ang mga blood vessels para ma-distribute sa oxygenated blood. And then the cycle will continue kung wala na siya oxygen, maagi naman sa vena cava, and so on. So next, the bile released from the gallbladder into the duodenum occurs only under the stimulation of, so ang inyo gani nga keyword is bile. So ang bile ginaproduce sa gallbladder. So cholecysto, diba? Kung dumduman niyo pa na inyong medical term, so cholecysto, gallbladder. So muna siya cholecystokinin. So we will discuss man sa iba nga mga choices. So this is enteropeptidase. So this converts trypsinogen into active trypsin. So ang trypsinogen is the proenzyme precursor of trypsin. So bali ang trypsinogen inactive form na siya nga enzyme. Gawlat lang na siya i-activate. So ang enteropeptidase, i-convert niya na ang inactive enzyme into an active enzyme called the trypsin. So active na ni siya nga enzyme. So enteropeptidase hydrolyzes some peptide bands of food proteins, but also it activates a number of pancreatic zymogens. So ano mo sila nga zymogens? So ang zymogen, part of the protein, blocks the active site of the enzyme. Bali, magsiling kita nga zymogen, this is also where the digestive enzymes are released in inactive forms. So, ang pancreatic zymogens, these are enzymes nga halin sa pancreas nga inactive. Kaya nga, may inactive kung may active enzymes. Kaya kung active always ang enzymes, kung wala ka may ginakaon, wala ka may ginadigest, tunawon niya na ang mga kasudlan mo dai. So, para nga ma-prevent na, so kinahanglan inactivated siya anay. So, kumbaga, i-activate na siya kung may ginausap ka da o may ginakaon ka da para sa digestion. So, amo na may inactive kag active enzymes. So, ang zymogens, necessary na siya to prevent the digestive enzymes from digesting the cells. Kay kung ano ang nagaproduce sa ila, base i-digest niya na or base tunawon na sang enzyme, di problema naman. So, for this reason, enteropeptidase is a key enzyme in the digestion of dietary proteins, and kung wala sang production sang enteropeptidase, So it can result to gross protein malabsorption. So para ma-absorb ang protein sa lawas, so enteropeptidase. Tandaan nyo lang ang peptide. So relevant na siya or pwede nyo siya malink sa amino acids. Okay, di ba may peptide bonds sa aton nga proteins? So, proteins. So, kung may digest ng proteins, kinanlanta ang enteropeptidase. It is an enzyme secreted with a small intestinal mucosa which activates the trypsinogen pakadto sa trypsin. So, muna ba ko gina-convert, gina-activate niya ang trypsinogen into trypsin. So, masiling kita nga proteolytic enzyme trypsin. So, these are also referred to as, ang inibalaho, protease. So, these are enzymes that break down protein. So, ang other terms ang enteropeptidase, so sometimes it is also referred to as the enterokinase. Tandaan nyo lang, diin siya link sa small intestine. Kaya di ba ang medical term ng small intestine is entero. So, enterokinase is an enzyme produced by the mucosa of the small intestine. So, ang main purpose ang enterokinase or sang enteropeptidase, isa lang na sila, ang ilang main purpose is to activate trypsinogen into trypsin. Okay, para sa absorption sang protein. Okay, next. Gastrin. So gastrin is a hormone produced by G cells. So G cells or gastrin cells muna siya. In the lining of the stomach, so sa stomach siya gina-produce as well as sa upper part of the small intestine. So two principal biological effects of gastrin. So ano yung purpose? Ga-stimulate sang production sang acid from the gastric parietal cells as well as nag-stimulate some mucosal growth sa acid secreting part of the stomach. So, ang gastrin cell is a type of cell in the stomach kag sa duodenum, kaya di ba mo sa upper part ng small intestine, that secretes gastrin. So, again, ang purpose ng gastrin para mag-stimulate sang secretion or production sang gastric parietal cells as well as mag-stimulate sang growth, mucosal growth sang acid secreting part of the stomach. So, muna sa gastrin. So, tandaan nyo man yan, sa stomach na siya kay gastro, stomach sa medical term. And sa parts ng duodenum. Next is secretin. So, it is a hormone that regulates water homeostasis or balance ng water throughout the body as well as it influences the environment of the duodenum by regulating the secretions coming from the stomach, pancreas, and liver. So, ang secretin is a hormone na naga-stabilize sang water sa lawas as well as para nga panamion niyang environment sang duodenum nga naga-regulate sang secretion sang enzymes sa stomach, sa pancreas, sa liver. It is a peptide hormone in the S cells, so S also is for secretin cells, which are located in the intestinal gland. So, tandaan nyo yung kagina, ang gastrin, more on sa stomach. Tapos, may part lang sang, upper part lang siya sang small intestine, which is the duodenum. Pero ang secretin, so from letter S, to sa small intestine, gid siya. So produced in the S cells of the duodenum, which are located in the intestinal glands. So three main functions ng secretin: to regulate gastric acid, regulate the pancreatic bicarbonate, and osmoregulation or homeostasis sa aton nga duodenum ang environment. So what is pancreatic bicarbonate? So it is critical to neutralizing the acid coming into the small intestine from the stomach. So ginaproduce ni siya sa pancreas ang bicarbonate para ma-neutralize ang acid nga halin sa stomach pakadto sa small intestine. So ang sodium carbonate is secreted in the pancreas to help aid in digestion and also again to neutralize stomach acid generated during the digestive process and breaks down certain enzymes. So, ina-regulate na siya para kay kung tamaan kadamo naman sa pancreatic bicarbonate, so pwede man nga hindi na nami ang digestion. So, nag-help siya sa digestion. And lastly, for the cholecystokinin, so damo siya iba niya ngalan, CCK or CCKPC. So from the Greek chole, which means biles, cysto is sac or bladder, kenin is move, so meaning sang cholecystokinin is to move the bile sac or to move the gall bladder. So a peptide hormone of the GI system responsible for stimulating the digestion of fat and protein. So, ang enteropeptidase, nag-digest siya or nag-absorb sa proteins. Ang cholecystokinin niya, fat and protein. So, when we say peptide hormones, these are hormones that are made of small chains, chains of amino acid. Again, peptide, protein, amino acids. The next question is, guys, kung may question, please, please ask, guya-uya, or basi wala ka mo question kay tamaran ka mo, hindi ka mo kayong chindi. So next question, blood leaves the right ventricle by passing through the pulmonary valve. So halin sa right ventricle, na-explain ko kagina, so pakita ko na ng liwat. So ang question da, blood halin sa right ventricles diin siya makadto dayon. So halin sa right ventricle diin siya makadto diri anay sa pulmonary artery. Then mabalik siya later, may siya return siya sa pulmonary vein, then left atrium, left ventricle, aorta, and to other parts of the circulatory system. So next is put in correct order the sequence in which excitation would move through the conducting system of the heart. So kagina, na-discuss ko siya. So diin siya gani una sa SA. node. So kung mabalaan nyo na kung di ng una, so pwede na kamo na maka-eliminate sa inyo choices. So ang SA node, di ba, muna siyang atong yung pacemaker, naga-regulate siya ang naga-determine sang BPM, beats per minute sang heart. So 4. So tananda nga 4 ang una, correct na na. So meaning sala na ang 1, 4, 3, 2, 5. Wala na ni siya, eliminate na ni. Kay 4 ang una. And then eliminate naman ni siya. Eliminate man ni. Duwa na lang yung pilian. Ari na lang kag ari. So after sang SA node, ano dayon? Ano dayon? Kung nadumduman niyo pakagina sa aga. Ano dayon guys? After sang SA node, ano dayon? Yes, AV node. Thank you, Pat. So AV node, that is number 3. So eliminate na ni. Tubalaan mo na rin na yung answer. So after sang AV node, the AV bundle or the bundle of his. So the AV node, tapos sa bundle of his or sa AV bundle, and then sa bundle branches, and ang pinaka-last is the Purkinje fibers. So correct answer is this one. So next, cerebrospinal fluid is mainly found between, di siya makita. Din makita ang cerebrospinal fluid. Then guys, ano answer da? Pia matter and arachnoid matter. Sige, thank you. So, ari ha, matong ko lang ha, mauna kita sa may SA node. Ari, SA node una. Then, there is a AV node. Then, sa bundle of his. Then, bundle branches. And later, sa Purkinje fibers. Okay, so sa CSF, so CSF is a clear and colorless fluid. So, watery broth, similar in its makeup to churrido blood plasma man. The CSF is a fluid that circulates throughout the CNS. So, the two important benefits of CSF sa atong nga CNS, so for circulation and shock absorption. So, circulation, the CSF delivers nutrients to the structures of the nervous system, as well as it removes the waste from the brain and spinal cord for detoxification of the nervous system. Another one is for shock absorption. The CSF protects the brain and spinal cord from trauma brought upon by the movement, falls, or blows. So, amo na ang two main functions or purposes of the CSF. So it is formed primarily in the ventricles of the brain. It supports the brain and provides also lubrication between the surrounding bones. So again, the CSF occupies or can be found at the arachnoid matter and the pia matter. So it fills the ventricles of the brain, cisterns, and sulci, as well as the central canal of the spinal cord. So, ari siya ha. So, ang blue, so amo nato nga CSF, so makita siya sa arachnoid, ari, kag sa pia mater, ari sa to nga. Galutaw-lutaw. So, occupies the subarachnoid space between arachnoid matter and the pia matter. So, next question. So, next question, its branches supplies the head and upper extremities. Sang aton nga aorta, diin sa ila kuno ang nagasupply sang blood sa head ko sa upper extremities. Diin sa ila. The aortic arch, correct. Very good. So to further discuss it, so the ascending aorta, ascending aorta, so ito nga ascending aorta, so it rises up from the heart and is about 2 inches long. The coronary arteries branch off the ascending aorta to supply the heart with blood. So, ang ginasupplyan niya is heart sa aton nga ascending aorta through the coronary artery. So, ang aton nga ascending aorta, so nagasupply sang blood sa heart. Ang aortic arch, so nagasupply sang blood sa head, sa neck, sa arms. And the aortic arch or the arch of aorta. Ang descending thoracic aorta, so nagasupply naman sang blood sa ribs and some chest structures. And hindi na di galing kita o ng aton nga abdominal aorta. So begins at the diaphragm. So sa dalom na siya, it splits to become the paired iliac arteries in the lower abdomen. So right and left iliac arteries. So ang aton nga abdominal aorta, mas split na siya into right and left iliac arteries to supply other major organs in the body. Okay, so next. The blood vessel of the pulmonary system include, so ang ato nga pulmonary system, it includes the pulmonary arteries and the pulmonary veins. So ang aton da nga choices, the veins, arteries, which also includes the pulmonary capillaries. So, muna siya may mga color ni bala sa picture. Muna siya ang aton nga pulmonary system. So, all of the above ang correct answer. Next, collecting vessels that bring the that bring blood back to the heart. So, the veins bring blood back to the heart. Ayun lang. So the capillaries, so ang ato niya capillaries to network na siya ra sa tunga naga-connect sang arteries kag sang veins. So the arteries deliver the oxygen rich blood to the capillaries where the actual exchange of oxygen and carbon dioxide occurs. So ang oxygenated blood halin sa arteries makadton sa may capillaries, tira na da kuno ang actual nga exchange ng oxygen kag carbon dioxide nag-occur. While the capillaries will deliver the waste-rich blood to the veins for transport back to the heart. So ang mga waste nga halin sa blood nga gindala sang arteries dalo na siya sang capillaries sa veins. And then the veins will carry the blood back to the heart. So, in addition, so again naman ito niya capillary atong network. So, kung sa before siya magkadto sa major nga ugat, sa mayor nga ugat, maagi siya na siya magagmay nga ugat which is called the venules. While diri naman pakadto sa atong nga arteries, antes siya magkadto sa mayor nga ugat, maagi anay sa arterioles. So, gagmay na ni siya nga mini version sang arteries, mini version sang veins. So next is exchange of blood and tissue constituents takes place through the so mo tiging discuss ko dira naga exchange ang oxygen kag carbon sa capillaries. So the aorta branches into arteries which eventually branch into smaller arterioles. So muna ba kagina do mini version sang arteries sang arterioles. And then arterioles carry blood and oxygen into the smallest blood vessels which is the capillaries. The blood will then leave the capillary to enter the venule. So halin di ang blood maagis, halin ang blood sa artery maagis sa arterioles pakadto sa capillaries. And then sa capillaries maagi anay sa venules ang waste-rich blood or ang unoxygenated blood, then makadto na siya veins. Then ang veins ma-deliver sang unoxygenated blood sa heart. So these venules become progressively larger and it will be now the veins. So again, i-cross mo na sa arterial, igagmay ang arterial, arteries dalagko na siya. Then venules gamay, then arteries, veins dalagko. Okay, next question. The blank of the heart is bluntly pointed end that is directed downward, forward, and to the left. So, very common na question. So, ano ang, kaya ang inyo the keyword is downward. Ano kuno ang lower part sang heart? Diba? That is the apex. So, usually, di ba, kung masiling kita nga apex sa babaw, pero sa heart niya baliskad, ang apex niya ara sa dalom. Ang base ara sa babaw. So, ang apex, so downward, forward, kapag siya sa may left na. Do, pero sa kuno sa inverted cone. So, ang base siya ara sa babaw. So, next question, the broad end of the heart that is directed upward. The opposite ito ay base. Next, the muscular layer of the heart is known as the, so may keyword na kamuda, muscles, muscular, that is myocardium. So, these are the layers of the heart. So, ang sasagwa, ang protective layer is the epi. So, kung sa medical term, epi, surrounding, para sa sagwa. Then, the myocardium, so myo is muscles. Endo, so susulod. Di ba? Kung sagwa, exo, or epi, diri or surround. So, answer is myocardium. So, the muscular middle layer of the heart. So, another term that we have is the pericardium. So, mayara kita duha ka klase sa pericardium, parietal kag visceral. So, parietal, pericardium, so mo nang mas outer pagid, visceral sa sulod. The pericardium is a thin, two-layered fluid-filled sac that covers the outer surface of the heart. So, ang epicardium, kung ang epicardium ara sa outer layer, sa sagwa pagid ang nagaprotect pagid sa epicardium is the pericardium. Provides lubrication for the heart. So, para nga po siya bala mag-pump, hindi siya sapnot. Shields the heart from infection and malignancy and contains the heart in the chest wall. So, as I mentioned, so duha ka klase ang pericardium, parietal kag visceral. So, parietal is the outer layer of a serous pericardium. Visceral, so outer layer man siya of the heart's epicardium. Bali, immediately after sang epicardium is the visceral pericardium. And then, ang pinaka-outer na ged is the parietal. So, as you can see here, so, already aton nga, for example, pericardium ta, then followed siya sang visceral, so ari epicardium, followed by visceral pericardium, and then pinaka-outer gid is the parietal pericardium. So, forms the lining of the sac that encloses the heart. So, mutambal ko, that is parietal pericardium. Next, openings into the right atrium include the following except. So, ano ang mga openings sa aton nga right atrium, kag ano ang hindi nadala sa opening sang right atrium. So, the four openings at the right atrium are the superior vena cava, the inferior vena cava, the coronary sinus, and the AV orifice or the atrioventricular orifice. Kung siling orifice, that is an opening. Magsiling kita nga ostium, ostium. So, it is also an opening. So, a mouth-like opening or an orifice man eh. So, muna siya apat ka opening sa right atrium. Tapos sa left atrium niya, we have the two pulmonary veins. So, ang answer dito sa aton question, so is the pulmonary ostium kaysa left siya. So, sa left atrium, siya ang pulmonary ostium. And the rest of the choices, it can be found sa right atrium. Okay, so next question. The abdominal aorta bifurcates at the level of the blank lumbar vertebra. So, diin siya nag-bifurcate. Musiling nga nag-bifurcate, nag-divide siya bala. So, diin nga level. Bas ko di ulan. Sa fourth, correct. Thank you. Salamat sa mga nag-respond. So, nag-bifurcate siya or nag-divide siya sa L4. Okay, so ano siya? So, area branches of the abdominal aorta. So, the major branches rising from abdominal aorta and usually visible in ultrasound. So, ang celiac trunk, so are, sa T12 siya. So, this is the first visible branch of the abdominal aorta, then followed by the superior mesenteric artery. So, between T12 kag sang L1. Then we have the renal arteries sa L1. So, renal arteries are important anatomical landmarks used to determine the location of abdominal aortic aneurysms. So, during ultrasound and other diagnostic tests, so, gina-evaluate ni siyang renal arteries kay if there is anomaly with the abdominal aorta, so usually mabalaan na siya and pwede makadiagnose ang abdominal aortic aneurysms. Then we also have the common iliac arteries. And then we have the aortic bifurcation, nari siya, sa level sang L4. Wala na siya nagtuon. So, sa level sang L4 na siya ang bifurcation. Again, nun sila nga bifurcate, so meaning naga-divide. So next, medical term, a prefix adeno means what? Yes, gland. Very good. Thank you. So adeno means gland. So ang joint niya is arthro. So pharynx. So pharynx or pharyngo. Brain is encephalo. Then we also have combining form indicating association with a large intestine. So large intestine, ang costo is rib, gastro is stomach, kaginang gastrin tagani. Then laparo is abdominal wall, and colo is the large intestine. Correct. Thank you. Thank you sa mga nag-answers. So again, costo is rib, gastro is stomach, laparo is abdominal wall, colo is large intestine. Next is OO4. OO4 is a combining form associated with ano? Yes, ovary. Very good. So ovary for OO4, uterus is hystero, fallopian tube is salpinx or salping, then I is ophthal or ophthalmo. Next is stomato. Stomato is, yes, mouth. Very good. So lips is labia, stomach is gastro, teeth is odonto or dental. Next, which of the following type of fractures is the most frequent and occurring at the site of impact? Yes, simple. Very good. So, simple. So, sa linear fracture, so there is a break in the bone, but it does not move the bone. So, ano lang, may bali or may break, pero wala sang movement, wala nag-change ang position sang bone. A green stick fracture, so nag-bend ang bone or nag-crack, nag-bend kag nag-crack, pero wala siya nabuka completely. Wala siya ba na na, na naglapta ang bones. So sa green stick, nag-bend lang kag nag-crack pero wala siya nabuka completely. Kumbaga do may guna lang siya. While a comminuted fracture, so the bone breaks into three or more pieces. So kumbaga na pudpud siya. So kung simple fracture na siya, the overlying skin is not broken. So ganun kay wala na move ang bone. Pero at the same time, the bone is not exposed to the air. Pero kung nagwa ang bone sa panit, so that is a compound or open fracture. Tama na siya ha. So we have there the linear. So ara siya, dira lang siya na contain, wala man siya nagwa. So pwede siya gani mahimo siya sa simple man. Then we have also the green stick. So ari do may guna lang siya. It does not break completely. Area sa comminuted. So nagubagid siya, na break siya into two or more. And we also have linear, dili siya pakadto. Linear, palaba, transverse, balabag. So mera mga oblique non-displaced kag oblique displaced. So sila nga displaced nag-move ang bone. The next is so what is located between the fourth ventricle and subarachnoid space or the cistern of great cerebral vein? Yeah. So that is foramen of Lushka. So, fourth ventricle and subarachnoid space. So, ari siya sa picture. Sorry, foramen of Lushka. So, mayroon mo ko di picture karon sa. So, ari. So, before that, so the foramen of Magendie, the foramen of Magendie is also referred to as the median aperture. This is one of the foramina in the ventricular system and links the fourth and cisterna magna. So, ari, fourth ventricle and cisterna magna. It is one of the three sites, ang foramen Magendie, that CSF can leave the fourth ventricle and enter the subarachnoid space. So the two other openings of the fourth ventricle include the foramen of Luschka or the lateral apertures, which can either be left or right. So the interventricular foramen or the foramen of Monroe, sa iba niya libro may E siya, sa iban O lang. Part of the ventricular system in connection between the third. So sa third ventricle siya kag sa lateral ventricle. So area fourth ventricle ang Luschka and sa lateral. So ang third ya kag lateral foramen of Monroe. Cisterna magna, so other term for that is cerebellomedullary cistern, one of the three principal openings in the subarachnoid space between arachnoid and the pia mater. The cerebral aqueduct or the aqueduct of Sylvius. So this is within the brainstem that connects the third ventricle to the fourth. So between the third and fourth ventricle is the cerebral aqueduct or the aqueduct of Sylvius. So, ano siya? So, ang median aperture ang atong nga Magendie. Then we have here the cisterna magna, makita sa fourth ventricles, foramen of Luschka sa lateral. So, so this makes up the ventricles sa brain. So, may medial ventricles and may lateral ventricles. So next question, what is located between the third and fourth ventricles? Bago ko lang na-mention. Okay, sige, correct. So that is cerebral aqueduct or the aqueduct of Sylvius. Correct. So how about this one? Which term means that the fracture is protruding through an open skin wound? Yes, correct. That is compound fracture. So may exposure sa air, nagwa sa panit. Kung wala gani ya, simple. Next, the most frequent site of nosocomial infection. Yes, one only. Kaya ang keyword nyo the most frequent. So, usually, ang most frequent nga nosocomial infection is UTI. So, therefore, ang most frequent site is the urinary tract. So, correct. Urinary tract. Next, divides the left and right cerebral hemisphere. Yes, correct. So, actually, fax cerebri na siya. Nagsala lang na ako na. Pero correct na siya, fax cerebri. Kailain man niya ang fax cerebri sa fax cerebelli. So, nagwa man siya sa board exam before. Kamu niya nga, tsura. So, the fax cerebri, also known as the cerebral fox. So it is a large crescent-shaped fold. So it is a fold of meningeal layer of dura mater, while the fox cerebelli, small enfolding of the dura in the sagittal plane over the floor of the posterior cranial fossa. So ang fox cerebelli nagadivide sang two cerebellar hemispheres. Ang fox cerebri nagadivide sang cerebral hemispheres. So, area cerebellar, amo na nga cerebelli, area cerebral, amo na nga cerebri. Okay, para hindi magtalang. Next, we also have the tentorium. Hindi na siya tentarium, tentorium na siya. Tentorium cerebelli. So, second largest dural fold, kaya ang largest is the fox cerebri. So, second largest is the tentorium cerebelli. It lies in the axial plane attached perpendicularly to the falx cerebri and divides the cranial cavity into supratentorial and infratentorial compartments. So, ang divide niya naman niya is babaw dalom. And another one sa choices tada is the tetralogy of Fallot. So, it is a birth defect that affects the normal blood flow sa heart. So, gintawag na siya nga tetralogy of Fallot kay composed na siya mainly sa tatlo ka heart diseases. Okay, so next. So, tetralogy of Fallot. In addition, tetralogy of Fallot is a combination of 4 congenital heart defects. So, these are the ventricular septal defect, the pulmonary stenosis, misplaced aorta, and a thickened right ventricular wall or the right ventricular hypertrophy. So, muna siya ha, nag-comprise ang tetralogy of Fallot, 4 ka congenital heart defects. So, ventricular septal defect, pulmonary stenosis, misplaced aorta, and a thickened right ventricular wall or the ventricular hypertrophy. So, muna nga, napak cerebri na gali. So, nag-divide sang left and right hemispheres ang fax cerebri. Sorry. Ang cerebelli, ari diya sa dalong. So, cerebellar hemispheres, area cerebral hemispheres. So, the infundibulum is the stalk of ano na siya, ang infundibulum. Ari ba lagay so? Infundibulum, stalk sa ano na siya? So, pituitary. So, stalk of pituitary gland or pituitary stalk. Okay, next. So, before I proceed, so I would just like to add, so if the infundibulum is the stalk of the pituitary gland, the habenula is the stalk of the pineal gland. So, habenula is the stalk of the pineal gland. So, the pineal gland is the smallest gland in the body, ha? So, makita na siya sa forebrain, sa likod sa brain nga portion. So, next is mayelo. So, mayelo is ano? Yes, combining form associated with spinal cord. Correct. Yes, thank you. Next, ari ka pila may magwa sa board exam. Where is CSF produced? Produced and secreted at the end. Yes, correct. Sa choroid plexus. Okay, next, the cranial nerve responsible for equilibrium and hearing. Yes, correct. So that is vestibulocochlear nerve. Then we also have here the only cranial nerve that innervates structures or naga supply sang ano, yes, vagus. So vagus nerve is also referred to as the wandering nerve. So, na lang. Transfer ko sa piyak. So these are the 12 cranial nerves. So ang vagus nerve for movement, sensation, and abdominal organs also referred to as the wandering nerve. Kaya kung di na siya kalambot, damo na siya yung may ginakatuan. So ang aton kagina nga vestibulocochlear for hearing and balance. Olfactory, of course, para sa smell. Optic for vision. Oculomotor, eye movement and pupil reflex. Trochlear for eye movement, trigeminal for face sensation and chewing, abducens for eye movement man gyapon, facial, syempre for face movement as well as a taste man. Then we have the glossopharyngeal for throat sensation, taste, and swallowing. Then we also have accessory nerve for neck movement and hypoglossal for movement, sensation, and abdominal organs. So I hope you are familiar man sa iyang mnemonics. O, to touch and feel. A girl's vagina, a heaven. Pero may ara, nabala ng liga, nabasa ko to 13, nabala mo, nalipat ko sa isa. Basta daw latest, pero wala pa na nabutang sa libro. O, to touch and feel. A girl's vagina, a heaven. So, I hope familiar ka muna. So, olfactory, optic, oculomotor, trigeminal, trochlear. Then we have abducens, facial, glossopharyngeal, vagus, accessory, kag hypoglossal. Okay, so let's go back sa next question. So, last question before ta mag-break. Ay, naman ako gin-share man. So, ingestion of a gas-producing powder or crystals, usually a preliminary to which of the following examinations? To the end. Yes, correct. So, double contrast. So, kung magsiling kita nga double contrast, nagagamit kita sang contrast media like iodinated contrast media, and then the other one is gas. So, so two only. Okay? So, before we proceed, so let's have a short break. I think 15 minutes na break. So we will be back at ano na 2:55, 3:10. Sige, so ma-break tanay. Sige, so let us continue. So I hope naka-recharge na. Sige, so next item. In reviewing a patient's blood chem, especially kung undergo mga IVP and contrast examinations sa kidneys, ureters, kag bladders. So, gina-require ni siya ang blood chem, especially ang BAN kag ang creatinine. So, which of the following blood urea nitrogen ranges is considered normal? So, the correct answer is A to 25. So, may ginbutang ko din yung feedback. So, the range of normal levels of BAN is between 7 and 22. So, ang pinaka-swak dira sa atong choices, so 8 to 25 milligrams per 100 ml. So, palimiara, iban nga 25 is still considered normal. When the result is greater than 50 milligrams per deciliter, this indicates an underlying medical problem. So, may problem sa blood chem ng patient. So, most likely, kung taas ang iyang ban, so hindi na siya madayon ang iyang nga contrast examination like IVP and KUB, kay kinahanglan pa siya na i-treat, mag-medicate. Ban levels also change with gender and age and during pregnancy. So generally, bond levels increase with increasing age. So for the creatinine ratio, so it's between 5 to 20 milligram per deciliter. So iyan na isang creatinine level. So ang bond test usually gina-perform na siya together with the CREA and the level of creatinine in the blood, so will determine kung naga-function maayo ang imong kidneys. So kung taas ang creatinine level mo above 20 milligrams per deciliter, so meaning there's something wrong with your kidneys kaya wala na siya nagapagwa sang waste maayo. So creatinine is a form of waste. So, the best, although indirect measure of kidney function is creatinine and not the blood urea and nitrogen. So, if you want to test, if you want to know if your kidney is functioning well, so creatinine gid ang pinaka gina-recommend nga examination. But there are some nephrologists, mga specialized sa kidneys, nga gagamit sang ban, nag-request sang ban or blood urea and nitrogen to determine whether or not the patient is dehydrated. So, muna ha. So, let's proceed. So, phlegbo is a combining form associated with ano? Ang phlegbo. Yes, correct na, Pat. So, phlegbo is vein. So, artery is arterio. So, blood vessels is angio. And then heart is syempre cardio. Next, combining form denoting women. Yes, correct. Gynae. So, neo is new, like neoplasm or new growth. Pectoral for chest. Oo for ovary. Next, suffix indicating surgical removal of a part or organ. So what is the answer? Yes, ectomy is correct. So, oma is swelling or tumor. Otomy is cut or to cut something. Oid is like or similar, like hemorrhoid. So, like blood. So, ectomy is surgical removal. Surgical cut is otomy. Next, which of the following statement is true? So, true ang gallbladder refers to choledoco. Sige, choledocco, doko is for duct. So that is bile duct. So gallbladder refers to cholecysto dapat ang correct. So sala na ha kung doko that is duct. So doko is bile duct. Cholecysto is gallbladder. So correct feet refers to poggia. So ang ear refers to naso. So naso is nose. Then spleen refers to hemo. Hemo is blood. Next, suffix indicating an inflammation. Yes, itis, correct. So ism is so like man siya, do pareho sila. The state of iso is the same. Iasis is condition. Next is indicating paralysis. So yes, that is correct. That is plegia. So plura for refers sa lungs. Nya or like apnea, dyspnea that is for breathing. Phagia is for swallowing or eating. Plegia is for paralysis. Next, a puncture of a cavity or organ to draw a fluid. Yes, correct. That is centesis. So centesis is the correct answer. So ectomy is surgical removal. Iasis is condition. Otomy is surgical cut. Next, a joint that is ankylosed. Masili nga ankylosed, that is a stiffness or hardening. Okay, so that is correct. So immobile, katitigaan na siya. Next, someone with tachypnea will breathe. Yes, correct. So rapidly. Kay kung hinay, that is bradypnea. Kung painful, dyspnea or difficulty. Next, the qualification of the members of the Board of RadTech are discussed in what section of RadTech Act of 1992? Okay, correct. So that is section 7. Section 4 is the practice of X-ray tech. Section 5 is the practice of radiologic technology or RadTech. Section 6 is creation of the board of RadTech. Next, a drop kidney. Yes, correct. Nephrotosis. So, ptosis meaning drop or hindi siya sa iyang sakto nga placement na naog siya. Nephrosclerosis, so hardening na siya sang kidneys. Next, the practice of RadTech shall include any and all acts by which one renders, furnishes, or contracts to render or furnish professional service as RadTech is stated in what section? Sige, so the practice of X-ray tech is section 4. The practice of RadTech is section 5. So the correct answer is section 5. So, practice of Rad Tech, section 5. X-ray Tech is section 4. Next, the rules and regulations governing the exam, registration, licensure, and practice of Rad Tech and X-ray Tech was promulgated on saan oh? Yes, correct. So, ang rules and regulations ng exam was on September 20, 1993. Tapos, ang first computerized exam was on December 27, 1993. So, ang April 22, 1992, that is the approval of RA 7431. Ang February 27, 1992 is the creation of the Board of RadTech. Yes, correct. September 20. Lagi na ba ako ng answer bago lang? When was the first computerized board exam for RadTech? Yes, December 27. Correct. Next, there are how many sections in the RadTech Act of 1992? Yes, 30. What section is missing? Ano nga section ang missing? Excited si Pat. So, missing is so may 28, may 29. The missing is 29. Kaya ang 28 is repealing clause. Ang 29 is missing. Next, the members of the board is composed of how many RadTech? Yes, 3. So, isa ka chairman nga RadTech, kag duwa ka members nga RadTech. Ang mo na sa board exam nagligad 2 years ago. Next, the chairman of the board of RadTech must be yes, must be RadTech. RadTech lang gid ang pwede maging chairman. Next, RadTech Act of 1992 is yes, RA 7431. So, ang chairman sa board of RadTech, dapat RadTech lang gid ha, hindi pwede radiologist, hindi pwede physicist. So, RadTech lang gid. So, ang radiologist kag physicist, so members lang sila sa board of RadTech. So, RA 7431. Next, who was the DOH secretary? Sino ang secretary during the approval of RA 7431? Wala man nagasabat. Wala namin nagasabat ha. Wala gida. Sige, so the secretary was Juan Flavier. So, secretary si Juan Flavier. And then si Raul Mitra was the si Raul Mitra ay Ramon Mitra na dagali. Ramon Mitra was the Speaker of the House. Si Neptali Gonzales was the Senate President. So si Jose de Venecia, Speaker of the House siya pero after na So, rason na siya nga ka-congress. So, again, si Ramon Mitra, nadaan din na si Raul. So, Ramon Mitra was the Speaker of the House. Si Neptali Gonzalez was the Senate President. Then si Juan Flavier was the DOH Secretary in 1992. Next, radiology is a branch of medical science which deals with the use of radiation in the diagnosis, treatment, and research of diseases. So this is stated in what section of RA 7431? Yes, so that is section 3, which is the definition of terms. So section 1 is title, section 2 is statement of policy, section 3 is definition of terms, so amo nang ang sabat. Then section 4 is the practice of X-ray tech. Next, the members of the board of RadTech can only be appointed by who? So that is correct. Can be only appointed by the President of the Philippines. So bali kung mangita sila members ang Board of RadTech, ang ato na nga APO is Association of Professional Organization. So ang aton nga APO, Accredited Professional Organization. Diri sa Philippines, sa mga RadTech is the PART or the Philippine Association of Radiologic Technologists. So kung mangita sila for example RadTech nga members ang board of RadTech, so ang ma-recommend na is the PART or the Philippine Association of Radiologic Technologists. Again sila ng aton nga APO or the Accredited Professional Organization. So ma-recommend na sila ang PART sa PRC. So, i-check na sa PRC ang ilang mga requirements, qualifications, kung qualified sila as members of the board. And then the PRC will recommend sa president. And the president will appoint the members of the board of RadTech. So, amo man nagakatabo sa board sang iban nga profession, sa board of nursing, board of medtech, board of engineering. So, amo man na ang ilaman nga apo ma-recommend sa PRC. And then the PRC will evaluate the requirements and then the PRC will recommend sa president ang president ang ma-appoint. And because the president is the one who can only appoint the members of the board of RadTech, siya man na, ang president man na ang pwede makapahalin sa members or sa officers ng board of RadTech. Okay, next. The qualifications of the members of the board of RadTech are as follows. Must be at least 30 years of age upon appointment, must have at least 10 years of experience in his respective field, and must be a Filipino citizen. Yes, correct. That is all of the above. So 1, 2, and 3. So if you want to be a member of the board of RadTech or if you want to be the chairman of the board of RadTech, so amo na ang minimum requirements. 30 years, at least 10 years na sa service, and also must be a Filipino citizen. May mga iban pa nga requirements like syempre wala kaso, good moral standing, may contribution sa profession. So amo na iba yung mga requirements man. Next. Patient is apprehensive of being injured. Ano answer? Yes, assault, correct. Kaya mo sila kang apprehensive, do ano pa lang, feeling niya pa lang na wala na isang sa basihan pabala to feeling niya do ma-injure siya, magka-injury siya because of the actions of the radtech or the healthcare worker. So assault na siya. Pero kung nagtupa na, that is battery. So tort is the intentional negligence. So under sa tort, meron kita battery, assault, false imprisonment. So next, new provisions, rules, or regulations cannot immediately take effect upon promulgation. These provisions, rules, or regulations can only take effect after how many days? If it has already been published in the newspaper and other general circulation. Yes, correct. 30 days. So kung may mga bago nga mga guidelines bala nga i-issue, for example, ang Board of Radtech, so hindi na ya agad-agad nga ma-implement. So ikinahanglan ipa-announce pa na sa TV, sa social media, sa newspaper, basta to ensure nga tanan or majority sang members makabalo. And after 30 days, ma-take effect na siya. So regardless kung nakabasa kaya kung wala, kung na-inform kaya kung wala, basta after 30 days, so ipa-publish na ay pa-implement na siya ang mga bago nga guidelines. Next, repealing clause can be found in what section? So yes, repealing clause is in section 28. So 29 is missing. 30 is effectivity clause. 27 is appropriations or ang budget ng board. Next, a harm resulting from physical contact with the rad tech. So for example, during positioning, nabali siya or napilasan siya. Yes, correct. That is battery. The names of the successful examinees of the board shall be released within how many days according sa PRC? Yes, according to PRC, it should be released within 120 days. So, gin-base pa ninyo nila isang 1992 nga dugay-dugay ang result tagpila ka bulan. So, subong ya 2 to 3 days pinakadugay na gid 1 week ara ng result. So, hopefully before matapos ang tuig, exam niyo is December 2021. So, dapat RRT na kamutanan. So next, the Professional Regulation Commission is also known as so AO 35 is the guidelines of the BHDT or the DOH on the regulation of the use of machines emitting X-rays. So, meaning, for example, kung mapatindog ka X-ray clinic, tanan nga mga guidelines, tanan nga mga requirements ara sa Administrative Order number 35. Ang EO 266, so amo na siya sa una ang aton nga CPD. This is the institutionalization of the continuing professional education. So 1995 pa na siya galing renew na ni siya ang CPD unit sang 2016. So amo na siyang EO 266 sa CPD na siya. Ang RA 7431 ti amo na ya ang aton nga Radtech Act of 1992. Ang PD or Presidential Decree number 223, amo na siya ang PRC or the Professional Regulation Commission. Okay? So PD 223. Next, the usual patient prep for upper GI. Yes, correct. NPO for 8 hours before the examination. Next, a certain radiographic exam is performed to Misterioso. After the exam, the radiographer left the patient in the table unattended for a while to show the radiograph to the radiologist. When he returned, he found Misterioso at the floor and a fracture has been sustained due to the fall. If Misterioso will sue the hospital, the following principle or principles will apply. So, res ipsa loquitur or the thing speaks for itself. So, obvious na kay may fracture na si Misteryoso. And respondeat superior, yes, may salabton man ang hospital because of the principle gani nga kung ilang members makasala, makakommit sang mistake, so pwede man nabat ang hospital. So, correct ang 1 kag 2. And force majeure, so hindi siya applicable kay that is acts of nature. So 1 and 2 is, or 1 and 2 are correct. Next, what number of breaths per minute represents the average rate of respiration for a normal adult? Yes, correct. That is 10 to 20 ang normal beats per minute. Isang respiration. Next, an individual's legal document that names the person authorized to make all healthcare decisions should they be unable to is called. Ano answer? Sige, so for instance, may patient nga kinahanglan mag-undergo surgery or invasive procedures. So, na-foresee niya na na-explain sa doktor nga for example, may possibility nga during the operation, so ma-render unconscious ang patient, syempre kay ma-undergo siya general anesthesia, tapos kung kinahanglan mag-make decisions, so since unconscious ang patient, so, kabalo siya nga ma-unconscious so ma-issue na siya sang amo ni nga document para nga maghatag sang kumbaga the authorization letter sa iya nga nakilala sa family niya or sa iya doktor or sa iya nga lawyer nga maghimo sang decision in behalf of him or her. So this is what we call the Advanced Healthcare Directive. So, ang Advanced Healthcare Directive, doon mo nang yung Advanced Healthcare Proxy. So, pwede na yung nga family maka-make decisions for him or for her. Ang living will, so nakabutang manda nga kung ano matabo sa iya, so kinahanglan mo unang tanan para makasurvive siya. So, correct na ang 1 and 2. Ang last will and testament ya, di ko mo patay kaya kung sino mo bilhin mo mga manggad. Next, which of the following gauge needles has the largest bore? So, dako ang buo sang needle, tienda. So, that is 12. So, mas gamay ang number, mas dako na iya buho. Mas gamay na siya nga needle. Kung taas iya number, like 23, 27, 28, gagmay na gina siya katama. So, 12 ha. The higher the number, the smaller the bore or ang buho na balas ang aton nga needle. So, kung nubo ang number, mas dako. So, 12 ang answer. Next, which of the following refers to the patient's right to privacy? So first, patient modesty must be preserved, patient dignity must be respected, and patient confidentiality must be respected. Sige, so correct answer is all of the above. So magsiling kita nga patient modesty ang iya nga huya bala syempre kung pailisan mo sa for example, so must be preserved ang iya nga huya, iya dignity kag iya nga confidentiality. Next, patient's consent is necessary at all times. So consent must be obtained before performing any radiographic examination. The following are conditions in order for the consent to be valid. Patient must not be necessary of legal age. Patient must be of sound mind. The patient must give consent freely. Sige, no answer. Si Pat na lang nag-answer. Sige, correct answer is 2 and 3 only. Kaya ang 1, dapat the patient must be of legal age. Ariya kay must not be. So, wrong na siya. So, 2 and 3 are correct answers. Next, if the patient lacks decision-making capacity, their rights can be exercised on their behalf by designated surrogate, proxy, no one. Sige, correct answer is ang designated surrogate kag designated proxy pareho lang na. So correct answer is 1 and 2. So kung hindi siya in-expect yung kagina, kung hindi siya maka-make decision, hindi siya capable, so pwede siya hatag sa surrogate or proxy na mag-decide para sa iya. Next, which of the following communicate or communicates messages to the patient? The rate of speech, the eye contact, or readiness of the radiographic room. Sige. So, the rate of speech, kung dasig ka magambal, or hinay ka magambal, or dako imo tingog, So, pwede siya maka-send message sa patient nga irritated ka or natak-an ka. So, correct na ang 1. So, kung correct ang 1 sa choices nyo, duwa na lang bilin eh. Ang 1 only, kag 1, 2, and 3. Next, eye contact. Yes, maka-send man na message, makita man na sa pasyente kung naga-establish ka eye contact sa iya or wala ka gatulok sa iya, but silingon natak-an ka, doon mo ng message ka ma-receive niya. So, correct ang eye contact. So, meaning, ang imo answer, ari na siya sa katapusan eh, kaya ng 1 kag 2. And number 3, readiness of radiographic room. So, syempre, makasend man na message kung pagsulod ng pasyente ang imo nga x-ray room, hipid-hipid, but silingon nami ka nga radtech, or kung pagsulod niya, nagarurukan, nga karalay, agalapta sa salog ang mga kaset. So, makasend man na siya message. So, 1, 2, and 3. Next, to reduce the back strain associated with transferring the patients from stretcher to x-ray table, you should A. Push the patient, hold the patient away from your body and lift, bend at the waist and pull the patient. Sige, kayo nagabasa ko sa inyo sa answer. Okay, the correct answer based sa aton nga body mechanics sa patient care, that is pull the patient. So basta may ginasakwat nga bugat, so dapat palapiton sa lawas sa center of gravity para nga ma-avoid ang back strain. So hindi pwede i-push kay mas malayo siya ang bugat, malayo sa imong mga sakit imong likod. Then hold the patient away. Hindi gani pwede nga palayo sa imo. So, may ara gina-specific nakabutang sa libro ni Torres kag ni Ehrlich sa Patient Care for Radtech, do not bend at the waist and pull. So, dapat ang gina-bend is the knee, hindi ang waist. So, pull the patient. Next, the normal adult oral temperature is, sige, ano answer? Correct na ang pull the patient, ha? Ano answer sa normal adult oral temperature? Sige, so when taking the temperature for adult, so ang pinaka-accurate gid is the rectal. So ang rectal temperature amo nang pinaka-accurate, pinakataas man nga reading compare mo sa iban nga site, and also pinaka maka-cause discomfort sa patient. So although pinaka-accurate siya, galing kay discomfort sa patient, so wala siya usually gina-practice ang rectal temperature. Ang pinakanubo naman kag pinaka least accurate is the axillary temperature. Pero amo nang pinaka komportable sa patient. So again, ang pinaka-accurate is the rectal. Pinaka-taas man siya nga reading compare sa axillary kag sa oral, and discomfort galing sa patient. Axillary, pinaka-komportable ang patient, pero nubo ang reading, at the same time least accurate. Ang oral temperature, so ara siya tunga-tunga. So oral temperature is higher than the axillary temperature, or pwede siya lower than the rectal temperature. So wala isang lower than rectal. So dirita ang correct answer is higher than axillary temperature. Next, the period of contraction of the heart is termed as, Yes, systole. Diastole is the resting phase. Dyspnea is difficulty of breathing, hypertension to increased or elevated blood pressure. Next, below are the conditions where an X-ray or rad tech will be exempted to take the board exam. So, ano answer? Yes, correct. Both A and B. So, has passed the civil service exam before April 22, 1992 is ang in-implement ang RA 7431. Also exempted man ang mga first members of the Board of Radtech, sila Day Fortunato Gabon. Exempted sila, kay sila syempre, ikaw na ginagubras ang RA 7431. Hindi ako pag-exam kagalingon mo, di ba? Makakapa-exam. And ang number 3, correct na siya tani, tani lang, galing kay ang word nga cumulative. Subot silingon masiling kitang cumulative, kung tutuntat ka bla 2 years subong, mauntat ka bi 3 years, maubra ka naman 5 years, mauntat ka naman, then maubra ka naman 3 years, so naka 10 years ka. So hindi na siya pwede, dapat ang word na da is continuous. Sige-sige, wala untat, wala gap. So correct answers are A and B. Next, a patient who is diaphoretic has yes, correct. So palangyami na diaphoretic, palangyami, pamalhas. So panglapsi. So pale, cool, clammy skin. Next, refers to hospital liability that may be incurred due to hiring of unlicensed medical staff that habitually commits negligence. Ano answer? Okay, your answer are vicarious. So, correct. So, vicarious ang results from the sala nga ubra sang staff or sang member sang hospital. Ang corporate so unable to provide a safe environment for the patient. Next, often called consequentialism. Okay, utilitarianism. So that is correct. So sa utilitarianism, ang iyan nga principle is that kung diin ang dako tsansa makasurvive, kagdamo sila, amo na iya ang unahon. Regardless man niya sang severity sang imo nga case. So for example, kung may isa ka truck nga nabunggo, isa ka truck nga pasahero nabunggo, tapos ang karga sa truck may 20 kabilog, ang duwa 50-50, tapos ang 18 or ang 18 mga bakiras lang. So dako iya ang chance nga makasurvive tong 18, so unahon na iya ang 18. Amo na sila yung unahon nga i-attend dalon sa ospital bulungon. And then ang duwa to yung 50-50 gamay ila chance mabuhi, so ipaulihi sila. So amo na siya sa consequentialism or sa utilitarianism. So opposite na sila sang deontology. So ang deontology is duty. So dapat unahon gidya kundi ito ang may severe case or critical condition. Next, this is described as the person's self-reliance, independence, liberty, right, privacy, individual choice, freedom of the will, and self-contained ability to decide. Yes, correct. Autonomy. So, beneficence is to do good, ideals, amo nang gina-aspire mo nga perfection. Next, instruments needed to assess the vital signs include blank. Yes, correct. 2 and 3. So, watch with a second hand para mag-isip sang respiratory rate, mag-isip sang pulse, then thermometer for temperature. Kag kung may ara BP up, so sphygmomanometer kag stethoscope, ti isulod. Pero kung wala, ti 2 and 3 lang ang insakto. Next, litigation involving a radiographer's professional practice is most likely to involve the private injustice. The following is or are the areas where frequent litigation in radiology occurs. So what do you think is the correct answer? Sige, sino pa may iba niya? Sige, correct answer is 1 and 3. So patient falls and positioning injuries, errors or delays in diagnosis. Tatlo na sila na pagiganing isa. Tatlo na sila mo, pinalipat ko sang isa. Dali lang. Nalipat pa nung damong ko, dali lang. Kung matandaan, karon lang. Madamdaman ko lang siya karon. Sige, let's proceed. Dapat tatlo na sila. Kung sala na siyang number 2. Next, a pulse can be detected only by the use of a stethoscope in which of the following locations. Yes, correct. So, apex. So, ang pulse sa wrist, sa neck, sa groin, pwede lang mapalpate. Ang apex siya sa heart. So, kinahanglan magamit stethoscope. Next, for negligent tort liability to occur, the four elements must be present. Duty, breach, injury, and cause. So, which of this is synonymous to deviation from duty? So, correct. That is breach. Next, the most common means of spreading infection. Yes, human hands. Kaya ang most effective way, gani, di ba, of preventing spread of infection is hand washing. Next, the elements needed to produce infection are a source, a host, and a means of transmission. An example of a source of infection might be sige, source of infection. So, a RadTech student who has a cold and comes to work. So, muna siyang pinaka good example of a source of infection. Kay ang visitor in the hospital was a fever blister on her mouth. Di sa ba niya man na iya unless kung ma lips to lips kamuda, di pwede ka malatnan. So, patient to develop sa pneumonia, subot silingon ng patient, ara na nga daan sa hospital, tapos naka-develop siya pneumonia, so pwede niya nosocomial infection, pero hindi siya mangin best source bala sang infection sa bilong nga hospital. So, pinaka, best example, so Radtech student nga may cold kag kadto sa workplace. Next, when an injured patient requires assistance with dressing or undressing, the RadTech must remember to what? So sa dressing, kag sa undressing, tandaan kung sa undressing, so tatlo na siya kayo. Tatlo kayo sa undressing. Wait. So sa undressing tatlo, actually apat siya kayo eh. Undressing. Una, uba, unaffected. So una, uba, unaffected. So apat siya kayo eh. Undressing. Sa dressing naman, laging type ko na sa chat box. Sa dressing, USA, una, suksok, affected. So, muna sa dressing and undressing. So, ang question di is dressing or undressing. So, diin ko na yung tsakto. So, number 1 is place clothing on the injured side. So, di ba, suksok, una, suksok, affected. So, correct ang 1. So, sa undressing, sa number 2, remove clothing from the injured side. So, wrong. Kaya dapat, una, uba, unaffected. So, syempre, sala mo ng 3. So, correct answer is 1 only. So, next, what is the most frequently used site for IV injection of contrast agents? So, Yes. So that is antecubital vein. Correct. Next, a patient's IV bottle or bag should be hung. So that is 18 to 24 inches above the vein. Correct. Next, a patient's feeling of spinning or the room spinning about him is called, yes, vertigo. So, ang orthostatic hypotension, so naganubo ang blood pressure kung gulpi lang mag-change position. Or from gapungko, gulpi ka lang magtindog, so manubo mo BP, that is orthostatic hypotension. Epistaxis, ti bleeding sang nose. Syncope is fainting or kalipong. Next, a patient experiencing an episode of syncope should be placed in which of the following positions? Yes, so basta may dugo ka pang lapsi na nga daw malipong, pahigdaon, pataason ang tiil. Kaya usually ang cause nga nagakalipong or nagaka-unconscious ang isa ka tawo is kulang ang oxygen level sa iyang brain. So kung pagdaon siya pasakaon niya tiil, so para nga dasig magbalik ang blood flow sa iya nga brain kag may oxygen naman nga ma-supply. So correct. Dorsal recumbent with with the feet elevated. Next, if a rad tech does not understand a procedure, so what should he do? Yes, correct. Ask the requesting physician kay siya lang nakabalo kung ano gin-request niya. So kay kung nurse on duty, so wala man kabalo na ang nurse sang gusto sa doktor mabalaan. So much better gid nga doktor. Next, each of the following is an example of a fomite except, yes, correct. So when we say fomite, these are inanimate objects. These are non-living things na pwede maka-help spread sang contagious disease. So non-living things or inanimate objects except ang tick. Correct. Next, Lyme disease is a condition caused by bacteria carried by deer ticks. The tick bite may cause fever, fatigue, and other associated symptoms. So, this is an example of transmission of infection by, yes, vector, kay carrier siya. Kung sila nga vector, sa muna yung nag-carry siya, fomite, inanimate objects. Next, which of the following can be transmitted via infected blood? So, TB, so hindi siya kay airborne na siya or droplet. So, H and HIV are correct, 2 and 3. Next, which of the following is or are symptoms of inadequate oxygen supply? Yes, correct. So, kung kulang oxygen supply, so kaplang yami ka, manandayaphoresis, ga bluish ka, kaya di kulang ganing oxygen mo, cyanosis, budaya kami ginawa, correct. So, 1, 2, and 3. Next, before performing which of the following examinations is a cathartic almost always required? So, when we say cathartic, so na yung mga dulcolax, example niya. So, correct answer is lower GI. So, para makapamusuon ka kag clear siya kung lantawon sa radiograph during exposure. Wala sang tae nga matabon. Next, patient's right include the following. So, correct, 1 and 2. The right to refuse treatment, the right to confidentiality. Kaya ang 3, the right to possess one's medical record. So, meaning pwede siya maka-acquire sa medical records ng ibang nga tao. So, hindi pwede. So, 1 and 2. Next, in what order should the following examinations be performed? So when requesting for several contrast examinations, so unahon anay ang iodinated contrast. Kay dasig na siya ma-flush out. Ipaulihi ang barium studies. So between sa tatlo sa ila, ang iodinated contrast ara sa IVU or sa IVP, so mauna ang IVU. So sa inyo choices, di ari na lang ang duwa ang inyo pilian. Wala na ni. Na-eliminate na siya. And then, between sa duwa ka examinations nga pareho sila contrast like diri sa aton upper GI ug barium pareho sila barium, unahon na examination nga ara sa dalom. Okay? Kaya kung nauna ka sa upper GI, paulihin mong barium mo, so hindi mo na siya makita kaya nasampawan to sa nga daan sang barium nga halin sa upper GI. So hindi ka kambal kung tsakto na ang imo nga diagnosis kay ti base halin to ya sa upper GI ang barium. So mauna anay sa dalom and then sa babaw. So una ang barium enema and then upper GI. So 2, 3, 1 are correct. Next, who was the first chairman of the board of Radtech? Okay, so the first chairman of the board of Radtech is Dr. Fortunato Gabon Jr. Siya ang first chairman sang board of Radtech kay sila na ang nagubra sang RA 7431 sang 1992. Si Norberto Palomo is the father of the Radtech education in the Philippines. Father of Radtech education in the Philippines, si Palomo. Si Wilhelmina Gana, chairman man siya sa board of Radtech, pero katatlo na siya bala mo. Kay puro na sila G. Ang first is si Gabon, followed by Gopez, si Nicomedes Gopez. So Gabon, tapos si Nicomedes Gopez. Amo na siya ikaduwa nga chairman. Ang ikatatlo nga chairman si Wilhelmina Gana. And then after ni Wilhelmina Gana, amo na si Subong, si Reynaldo Apolonio Isado. So amo na ang aton mga chairman sa Board of Radtech si Fortunato Gabon una, and then followed by Nicomedes Gopez. Patay na na sila nga duwa, si Gabon kay si Gopez. Tatlo ka G na sila. Si Gana subong ti ara pa ay may gana pa siya mabuwi, buwi pa saya. Kay medyo 50s na siguro or 60s. Then subong ang presenta si Reynaldo Apolonio Tisado, chairman sa Board of Radtech. Si Rolando Banyares, siya naman ni ang president sang part. The longest running president sa part. Sobra na siya 20 years. Next. Ari, akong question next. Nianseran ko naman ni. Father of Radtech Education. So, si Norberto Palomo. So, mga 90s na ni siya siguro. Pero, husog pa siya kay dati na siya nga military. So, si Staff Sergeant Norberto Palomo. Then, present president of the part. So, si Rolando Banyares. Next, issue 1, suspension or revocation of the certificates of registration for the practice of Radtech and X-ray Tech is the duty and obligation of Sige, so after you pass the board exam, so mapa-register ka muna sa PRC. And then sa PRC, so may schedule na siya for oath taking. So tagaan ka muna sang PRC ID, muna nang aton nga ID ang ginagamit. Pero aside sa gina-issue sang PRC, ang Board of Radtech naga-issue na siya sang Certificate of Registration. Kumbaga amo gina ang pinaka-proof mo. Yado pareho bala kung gi-eskwela ka, hindi ka kambal graduate ka kay may ID ka. Pero makambal ka nga graduate ka kung may diploma ka. So amo man na sa aton, so may PRC ID ka, so do hindi gina siya mong pinaka-proof nga professional ka na. So dapat may ara ka Certificate of Registration halin sa Board of Radtech. So sila na ang nag-issue, sila man na ang pwede makasuspend kung may mga violation ka. Discuss na siya ba sa RA 741. Kag sila man na pwede maka-revoke sang imo nga Certificate of Registration. So it is the Board of Radtech. Next, pathogens. So how would you able to describe pathogens? So 2 and 3. So pathogens are not always harmful ha, kay di ba nag-mention ko gani kagina nga miala kita opportunistic pathogens. So ara siya da pero wala kaga masakit. Kapangita na siya opportunity, maka-cause masakit. So number 1 is wrong. So therefore, kung mag-elimination process ka, wala na ni, wala man eh. Balayin mo na lang choices 2, 2, and 3. Then sometimes harmful, correct? So 2 and 3 na, ari na yung answer. So capable of producing diseases. So correct. So 2 and 3. Lapit na lang. So what ethical principle is used when a radiographer is justified in taking actions in instances which not acting would do more harm than the lack of patient input into the decision? Yes, correct. Paternalism. So it's like kuno being a father nga kung hindi capable ang imo bata mag-make decisions, ikaw ang ma-make decisions because kung hindi ka mag-make decision, yung laton mo ang pasyente magbugtaw or maging conscious, pwede nga maglala ang iya nga kondisyon. So that is paternalism. So fidelity, so being loyal to your patient or being ang imo nga loyalty ara sa iya. Double effect, so your action, pwede siya may good kag bad effect. Non-maleficent, so avoiding harm sa patient. Next, adoption of seal or logo for the board was signed into law sa San-O. The correct answer is May 30, 1993. So, ano siya? May 30. Next, not all professions here in the country or here in the Philippines require board exam. Di tanan nga kurso may board exam. So presently, pila ka kurso sa Pilipinas ang may board exam. So pila? So the correct answer is 43. So 43 lang ha. Next, the type of shock associated with pooling of blood in the peripheral vessels. Na-discuss ko sa aga. So, inyo keyword na pooling of blood. Yes, neurogenic. Okay? So, I'll check kung sino pinakataas score sa inyo, di kagina. So far guys, may questions ka mo or clarification sa inyong neurogenics? Sa inyong na post, na pre-test? May ari di ba nakakuha ginando 90? Very bright. Kadugay mag-load. Sige. Sige. Sige, so tomorrow, we will discuss mga importante lang gid sa patient care, sa juris, medical term. Basta mga importante lang gid aton ni-discuss. Tomorrow, bilog nga aga. And then, sa hapon, ma-post test naman ta. Ang start siguro mga 2:30 buwas sa hapon, 1 hour nga post test and then ma-ratio ta. So dasig lang naman ang ratio buwas kay ti na discuss naka-discuss na tangadaan. Okay? So may mga request ka mga topic nga gusto i-discuss. O mera, gali 101 nga score. 99 tagas nga ninyo scores. Ano na guys sa subject na tapos nyo i-discuss? Na-review nyo? Saan o ka mo nag-start review?